Okay, well, welcome. My name's Cristol O'Loughlin, and I am the founder and CEO of Angel Aid. And a number of folks have asked recently, what exactly does Angel Aid do? What is the history? What's the background? How did you come into being? And what are the programs and services that you provide? So I thought we'd take a few minutes and do a briefing. So here we are. This briefing is titled Putting the Self Back into Care. And it's an overview of all the things that I just described. So we'll go ahead and jump in. What I want you to have a sense of, I always like when I'm listening to a recording or participating in a meeting, I want to know kind of where am I in the meeting. So here's the outline. So we're going to talk about who we serve, our Rare Mother community, and the rare families within this broad global community that we're a part of. And we're going to talk about why it matters that we provide the services that we do provide. And then we're going to talk about different ways that we can partner, how we can help serve the rare community and the whole family, and in particular, caregivers, and in particular, rare mothers within the family. So those are kind of the three big buckets. And before we get into the meat of who we serve, I think there's an opportunity for us to recognize that this pandemic experience has created an opportunity for us to connect with everybody on the globe. And what I mean by that is, as rare families, we've been living a trifecta of experiences that now everybody on the planet can relate to because of the pandemic. And that trifecta includes isolation, it includes medical uncertainty, and it includes disruptions in home and work life, right? So that trifecta, that is how rare families live every day, right? And since everybody on the planet has been experiencing something around COVID-19 and this pandemic experience, some sort of disruption, some sort of isolation, a lot of medical uncertainty, I think that there's an opportunity for us to just relate to our neighbors and our friends and even family members and people that we don't often reach out to and necessarily talk about our experience in rare disease, but I'm just encouraging you to try again, okay? That suffering sows the seeds of empathy, and empathy comes from a shared experience, and we've had that shared experience, okay? So keep trying, keep talking, keep reaching out so that you are resourcing yourself, surrounding yourself with people that are sensitized to your experience in the rare disease community. And Angel Aid comes from this shared experience. Angel Aid was actually started in the year 2000, but far before that, all the way back into the 1960s, my parents, Richard and Phyllis, met at Western High School in Buena Park, California. He was captain of the football team. She was head drill team leader. They fell in love and they married and had a basketball team of kids, 5 kids within 8 years. And it was a fast and furious growing of the family, and also a slow awakening to some of the developmental challenges that were happening with some of the kids. So you can see the picture on the far left. My oldest brother, Richard, was not born with the rare disease that my 3 older brothers, David, Jared, and Randy, were eventually born and suffered from and died from. Their disease, Hunter's syndrome or mucopolysaccharidosis, very, very rare disease, less than 3,000 cases worldwide. And that experience as a family really shaped all of us, caring for them, caring for ourselves after they passed. Bereaved families are a big part of our community in Angel Aid. And so it was that shared experience that became the foundation of our desire to cure at least one of the 7,000 rare diseases on the planet, MPS disease. And so we formed Angel Aid, a bunch of UCLA Pi Beta Phi sorority sisters. And we started doing what 20-year-olds do best. We threw parties. So we raised as much money as we could. We offered our very first research grant. And I'm so proud to say that research grant went on to a treatment for Hunter syndrome and a treatment for other MPS diseases today. So FDA approved treatments. And I've witnessed the power of philanthropy, starting with $1 at a time, all the way up into grants, and then the millions of dollars that it takes to bring a drug to market. And we are so grateful that young men today, many young men with Hunter syndrome, are able to receive this treatment, and have met a few that have gone off to college, and it's just amazing. So the focus on caregivers was a long time coming, but didn't actualize until 2018. And it was at that point, it sort of hit my heart. BioMarin, a pharmaceutical company up in the Bay Area, started building a building down the street from where I live. So I was driving past it every day, and I was like, okay, God, I know you want me to do more for rare disease. What is it? What is the gap? What's the mission? And it became clear that the rare disease community has organized as a community, right? It used to be every specific disease would focus on supporting their families and their community, their research efforts. But we figured out as a community, we're stronger together. And that's affected everything from lobbying on Capitol Hill for more dollars from the National Institute of Health, to affecting change in the FDA drug approval process, to providing support, family support. And so you've seen umbrella organizations like Global Genes and NORD, the National Organization for Rare Diseases, and Eurodis in Europe, and APEC in Asia Pacific region. So you've seen these organizations cropping up that are umbrella organizations for all 7,000 rare diseases and the families that those represent. 350 million people on the planet have a rare disease, right? So these are umbrella organizations. And in looking at that, we really did a deep dive on who's taking care of the mental health and wellness within rare families. And it became clear that we do not have an umbrella organization that's looking specifically at mental health and wellness programs for all rare disease families. And so we incorporated Angel Aid in 2018 and relaunched with this mission to provide relief to the caregivers. And in our world, that means rare mothers. So rare mothers are the primary caregiver in 82% of rare families. It's never an exclusion of fathers or uncles and aunts and grandparents and siblings and all of the other family members that provide caregiving support. It's never an exclusion of that. It's just our belief system that if we can uplift these women, if we can provide an environment where rare mothers can come together and talk to each other about their needs, their emotional needs, their need for connectedness, their need to know that they're not alone in this really unimaginable experience of caregiving in the rare family. That if we can provide that mechanism, we can provide so much relief, right? Just in bringing women together. And if we can recognize that these journeys last a lifetime, it's not in the psyche of the pharmaceutical industry and researchers to be thinking necessarily about the ongoing impact on the family, right? We're so patient-centric. We need to cure, we need to treat patients that there's a blind spot in the reality that as these patients, many passing away as children, half the rare community is children, and a third of those children will not see their 5th birthday. That is a lifetime of impact on that mother and that father, right? On the whole family, obviously. But about 20 to 25% of our community is bereaved mothers. And so we want to look holistically at this experience of caregiving across not just the patient's life, but also the caregiver's lifetime, because we know what the impact is long-term, ongoing on the family, right? And so we like to say that that rare mothers are the ROI. Investing in these treatments and these cures is so important. And while the rare disease pharmaceutical companies that are invested in rare disease, while they're doing the good work of bringing these treatments and hopefully cures, and I believe in our lifetime we're going to see cures to these many rare diseases, while they're doing that good work, while the research community is doing their work in science, while the patient advocacy organizations are doing their work supporting rare families and all of the lobbying work that's happening on Capitol Hill and with governments around the world, while all of those roles are happening, just know that there's a woman at the center of the family that is weighing in on all of these decisions about where she's going to put her time and her energy, not only in caring for the family member, but also externally to support. So investing in rare mothers, investing in their mental health, in their wellness, in their sense of emotional support and their connectedness with other mothers, investing in that is going to pay incredible dividends over time and make a huge impact on every part of the rare disease community. So Angel Aid is a global nonprofit network. We provide personal connection and emotional support to rare mothers. And these are women that feel isolated and overwhelmed so often. And that if we can bring them together, if we can bring you together, then we can provide an environment where you can experience compassion and relief services, right? And it's our goal, our stated goal, to support 3.5 million rare mothers by 2025. Huge goal, only 1% of the whole community, right? If there's 350 million rare families on the planet, there's 350 million mothers, okay, that have some sort of central role in that family. And we just want to support 1%. Huge numbers, but if we're thinking in those terms, and we're thinking about how can you support a large group of women, you can do that through mobile phones and technology. And so it just helps us think about how could we support this community at scale. And already we know that rare disease crosses borders, right? So we already know that we need to cross borders. And rather than starting with just a couple of families in California and then branching out, we decided let's start with the world, okay, and sort of support from California. So you see in California, we have a lot of rare families, but we also have rare families all over the country and around the world. And this slide says 14 countries. We just added Moscow, Russia in the last week. So we actually are supporting rare families across 15 countries currently. Thank you to Microsoft for providing that analysis so we could see. So why does it matter, right? Why this focus on caregiving? You know, isn't someone else providing the mental health and wellness support? Aren't the hospitals providing it? Aren't the aren't the pharmas providing it? Aren't the patient advocacy organizations providing it? The answer is yes. There are a lot of individual support programs out there. What we're trying to do is shine a light, okay, on the need for caregiver support services and also provide them to organizations that don't have the resources, to mothers that don't know where to turn, they still will likely and should connect with their disease-specific organizations. Okay, so we are complementary to that process. And the reason it's important to have the umbrella view is because we want to look at kind of things in a philosophical sense. Okay, so one of the things that I like to talk about one of the things that I talk about is the importance of recognizing the difference between our rare caregiver experience and other traumatic experiences. Okay, because caregiving in the rare disease family is not something that you do once and then recover from later, right? This is a chronic stress cycle. In mental health, we know a lot about PTSD. That's an accepted diagnosis, and you can receive a specific therapeutic regimen to handle PTSD. And I've talked to enough people in the rare disease space to say, gosh, sometimes I will work with someone to address what has been characterized as PTSD, but it doesn't actually really resonate with me sometimes because I'm still living it. It's like this still happening every single day. I'm waiting for the other shoe to drop, right? I'm waiting for this stressful event to keep happening again and again. And so this is a graphical representation of what I was just talking about, that there's a difference between a stressful event and the chronic nature of caregiving stress. Okay, once you become a caregiver, you're forever buzzing at this higher level of stress. Okay, and the reason, and this is all thanks to our partnership with Dr. Alyssa Eppel and UCSF. She was the author of a co-author of a book called The Telomere Effect. And this research is Nobel Prize winning research, right? Telomeres are the little receptors at the end of every cell in your body, and they get worn out from stress, right? The good news about telomeres is you can repair your telomeres with mindfulness rituals, daily kinds of activities that we know are good for us, right? So the obvious ones are, eating well, getting enough sleep, exercising, right? The less obvious things you can do to help avoid the stress of anticipating more caregiving stress, or anticipating going back into the hospital, anticipating that injection, blood draw, or IV, anticipating a seizure or another night of staying up all night to help care for your child, right? It's that anticipation and that rumination, that thinking about it again and again, that causes the stress. The antidote to that is mindfulness training, right? And so we want to provide things that bring you to the moment: breathing, yoga, meditation, the ancient arts and rituals that we know have a physical benefit to caregivers. And I would just want to recognize that that these techniques are not, they're wonderful to introduce in like a caregiver track or in a conference or something, but these are daily practices. And so to learn them, you have to sort of be in this repetitive cycle of talking with other people. That's why we offer support groups and workshops that are ongoing at Angel Aid, is because you need a chance to practice all of these things, right? So that distinction is really important. Understanding that caregiver stress is different than every other stress on the planet. And then also thinking about the support. So let's talk about defining support, because there's another place where we talk past each other a lot, right? And in this Psychology Today article, and if you do a Google search under Psychology Today, and look at why people, rare disease, need better support, right? So some of those keywords will help you find this article. But the different kinds of support are fourfold. Informational support and tangible support is what most organizations are already providing, okay? What is the disease? What are the symptoms? How do I manage those symptoms? How do I get genetics testing? How do I find doctors that know how to work with this disease? How do I get coverage for my insurance claims? How do I get grants for maybe co-pays on insurance claims? How can I find another group of parents that have been through this, or another group of patients that are going through this, right? So the informational and the tangible support is what most organizations are currently providing. It's under the waterline that Angel Aid is living, right? And this is a huge need in the rare disease space. We're providing emotional support and companionship. Okay, here's the beauty. That's what most patients and caregivers say they need the most. That's where they feel better, is when they're getting emotional support and companionship. The triage list of to-dos that need to happen in their life are happening, and they need to happen, right? But so often they're not getting to what they say they really need, that really brings deep relief, is the emotional support and the companionship. So that's where we want to live. That's where we want to keep elevating the importance of those kinds of services, and then provide those programs and services back to the community, either directly through our Rare Mothers communities, and we're launching Rare Fathers communities. We also support rare carriers. We've been supporting young adults and some patient direct initiatives as well. But our swim lane is around caregiver support and rare mothers specifically. And we want to provide those services directly, but we also want to provide the building blocks for other organizations to take advantage of those services. Okay, so let's talk about the different types of services and how we've organized them within Angel Aid. And it starts with how caregivers organize themselves. So this is a classic mental health question, because it has to do with feelings, right? So there's no right or wrong answer. It's just a statement of how you feel. And there's no judgment of that measurement of how you feel. It's just is what it is, right? So we often ask, on a scale of 1 to 10, how supported do you feel? How supported do you feel in this moment? And if you want, you could drop your answer into the chat. But on a scale of 1 to 10, so 1 is hardly supported at all, and 10 is fully supported. So if a mother or a caregiver is responding in the 1 to 5 range, we know that that individual is in crisis mode or on the crisis end of the scale, right? An extreme of that would be, I'm feeling so alone, I'm feeling so under-resourced that I'm feeling suicidal. And that happens, and we have to meet that need. So we have crisis text line support. We have 800 national suicide prevention number in the United States, as well as 35 countries around the world on our website, right? So that if someone is in deep crisis in that moment, they can get on the phone, they can get into a text exchange with someone at that moment, right? They don't have to wait. If an individual answers they're in wellness mode, right? And there's, okay, so I went one extreme end of the scale, and I didn't sort of bring it forward. But perhaps that individual just needs to work with a professional or a social worker or someone, a guidance counselor, or someone to guide them into ongoing support, right? So we want to make sure that we offer that as well. And then if an individual is answering on the 6 to 10 end of the scale, they're more in wellness mode. Somehow they've resourced themselves either with church or with family or with professional caregiving support, or maybe they've just done some really heavy lifting emotionally and they're just feeling like, okay, I got this, like I can handle it. Or maybe they're in the stage of caregiving where the burden is not as intense, and so they're able to handle it, but maybe that steps up over time, right? Or maybe they're further in the grieving cycle. Maybe they're in bereavement, but they've gone through some level of finding peace with what has happened. We don't know. We just know that we need to meet all of these individuals where they are. So when someone's in wellness mode, then you can offer things like yoga for caregivers, and you can offer deep breathing and mindfulness training, or Rare Mothers in Relationships workshops like we have running on Tuesdays at 10 a.m., right? So or these support groups like we have on Thursdays at 10 a.m. Pacific as well, right? So these different kinds of services are tailored to address the different needs, 1 to 10. So for crisis intervention, as I mentioned, we have the 800 number, we have links into Eurodece to provide support in these 35 countries around the world. We have a partnership with Give an Hour, and Give an Hour actually is a nonprofit that provides 6 weeks of direct one-to-one mental health support, which is a state-by-state mandated function, right? So if someone raises their hand and says, I need to connect with a professional, you've got to matchmake that caregiver with a professional in their state, right? And so we partner with Give an Hour to do that work. So on the crisis side, again, never any judgment. It's just, how can we support you in this moment where you are today? And then on the wellness side, we've been developing various different methodologies that we know create sustainable relief. Okay, and so our original methodology was called the Sustainable Mom, a guidebook for rare mothers, building a stronger family through self-care, right? And we ran this as in-person retreats, 4 days, 3 nights. We'd fly the mothers in to our retreat center, Barrett Family Ranch, here in Orange County, California. And then the pandemic hit, and so we needed to digitize that experience, make it virtual. But we always include tactile wellness kits and things that come in the mail, right? Things that can be touched and felt and smelled and tasted, so that we can activate your senses in service to you as the caregiver. So those methodologies, as well as like a whole YouTube library of meditations and sound therapies and art therapies, are all on our YouTube channel. Just do a search for @AngelAidCares on any of our social, and on YouTube @AngelAidCares is our handle, and you'll find those, and they're free. They're available for free. Okay. In the future, it is our intention to invite sponsors. We've received a few sponsors. So if you want to offer any of our methodologies specifically into your community, then just talk to us and we can talk about how to go out and get co-sponsorship. So maybe you want to run a Rare Mothers Wellness Retreat for your specific community. We can partner with you to do that. In the meantime, definitely subscribe to our newsletter, because we're constantly offering all of these services and experiences for free. Just go to angelaidcares.org and click on Join Our Community, and then that will get you into the conversation cycle of knowing how to connect with these offerings. Same for our support groups. So our community manager, Paige Rogers, is amazing, and she's constantly sending out notifications about things that are coming up that week, that month, over the next year. Our online community of Rare Mothers is meeting twice weekly. Our workshops, in this case on the right, we offered Voice of the Rare Carrier, and we had 25 carriers from around the world sharing their voice, so that we could shine a light on the carrier experience. So we're constantly offering these workshops and these trainings. So we have this amazing network of health and wellness practitioners. These are experts in their field of relief. And so we're looking at the communities all the time, talking to families, talking to mothers, trying to understand where are the pain points, where can we provide relief. So these are two areas, just as an example. One is around needle pokes. So if you're living a medicalized life, you are living often with needle fear and needle phobia. At least 10% of your community, if there's medicalized life, are having some issues with the needle pokes that are happening. So whether it's blood draws to test and diagnose, whether it's injections that are part of a treatment protocol or infusions that are part of a treatment protocol, there are things that you can do as a family, as a patient or as a caregiver, to ease that fear. Okay, you can take back some of the control over what feels like an uncontrollable situation. And you can physically relieve the pain through holistic practices, like using the Buzzy, which is a little vibrating bumblebee that works really, really well to interrupt pain messages between the pain and your brain, right? So we have a whole webinar and a kit, a wellness kit that we ship out into the home. And then on our a completely different note, we kept hearing that young adults are really having a hard time connecting with each other, and that this is a big pain point in the rare disease community. So we brought art and storytelling into that dynamic. And so what we do in that program, it's called the Who Am I graphic novel program. We've got a health and wellness practitioner, Mamiya Arbeles, who is an ex-Pixar alum who comes in and talks to our young adults about how to tell their story graphically and how to build a story arc and a narrative. And it's just an amazing program. We're going to be running it again in the next quarter, and hopefully more times next year as well. So definitely go to our website and subscribe to our newsletter so that you're, join the community, and then that will get you in the communications link so that you can see when these events and these things are happening. I love this quote. It's not unworthy, but it is very uncomfortable to ask for help. And that's from Sarah Chisholm. She's one of our original Rare Mothers. She runs BPAN. BPAN Warriors is a foundation. And Sarah came to our original retreat and slept for the first time in years. She said she felt safe to be in community with other mothers and to be able to create and carve out time to recharge, refuel, re-resource herself so that she could go back into the home and become that role, that foundation leader, that mother, that wife, all of those things, those other roles that we have as parents, daughter and friend and the like. So we're going to be honoring International Rare Mothers on our event it says October 23rd. We just changed the date to October 22nd, so one day earlier. But that is our yearly sort of big honoring of Rare Mothers. We do it in partnership with Microsoft, and it is a fundraiser and an awareness event. So if you're interested in participating in raising funds, in volunteering to help with the event, in donating directly, or most importantly, in nominating yourself or another mother to be recognized during this event, please go to the URL listed at the bottom of your page, and you'll have the opportunity to do that. Okay, so that's the overview. 30 minutes or less. We just wanted to share with you all of the things that we're doing in Angel Aid, our belief system, our desire to support the whole family, the whole Rare family. And we believe that we can do that most effectively by starting with the women in the family, by starting with the Rare Mothers. Again, Rare Mothers are the primary caregiver 82% of the time in Rare families, whether they're children or adult children, whether they're living in the home or out of the home. You never stop becoming a Rare Mother. You never stop thinking about your child alive or in heaven. you are a rare mother. We are here for you and all the people that are important to you, the siblings, the grandparents, the uncles, the aunts, the community members. We want to provide that full family support, and we want to provide mental health and wellness support. We want you to feel better, okay? And we believe that the mechanism to feel some level of relief, we're not curing your diseases, we're not providing treatments for your diseases at Angel Aid. We're partnering with all the amazing organizations that are doing that work. We just want to bring you relief. We want to bring you moments, just micro moments sometimes, of relief. Okay, so thank you so much for joining this conversation, this presentation. We hope to see you in our community soon. Again, whether you're a partner, whether you are a family member, a patient in the pharmaceutical industry, in the patient advocacy groups, within lobbying organizations, we are a collective of people who care about the rare disease community, and we care in particular about caregivers and rare mothers in even more specific terms. So thank you. Have a wonderful afternoon, morning, evening, and we will hope to see you in our community.